Hello, this is Cynthia, Module 6, discussion on substance abuse. Opioid dependence occurs when the frequent and repeated use of the opiates lead to a structural change in the brain, which makes normal brain function require the presence of opiates. Some of the physiological changes that occur in the brain include changes in the opioid receptors, the messengers and enzymes and kinases, increased number of dendritic spines on the neurons involved in the reward pathway. These changes cause a hypersensitivity in the brain's reward system, and the patient experiences cravings when in the absence of opioids. Structural changes also occur in the neuronal circuits involved in learning and memory, motivation, drive, and inhibitory control systems. Some of the behaviors in patients who are abusing drugs are seeking behaviors, sometimes despite devastating consequences. They constantly think about the drug. They may obtain multiple prescriptions of the drug. They have feelings of phantom pains in the absence of the drug, restless thoughts and behaviors, lying and stealing to obtain more drugs, using in secret, hiding drugs around the house, seeing 2 or more physicians to obtain additional prescriptions, spending time away from other people, going through money quickly, focusing on the drug more than anything else, sudden changes in social activities and mood swings. Some of the symptoms of withdrawal are nausea, vomiting, diarrhea. They have chills and shivers and tremors. They're jittery. They are sleeplessness. They have abdominal cramps, bone and joint pains, and muscle aches, and also severe craving of the medication. 42% of Americans 18 years old and older experience pain on a daily basis, and about 116 million Americans are burdened with chronic pain. So physicians and healthcare professionals should be aware of these drug-seeking behaviors and evaluate the patient's drug treatments, and they should obtain an informed consent and have the patient to sign a treatment agreement. They need to review the course of the treatment with the patient periodically, consult other healthcare professionals, especially psychiatric evaluations, because sometimes pain is induced by a disturbance in the mood or depression or anxiety. They need to keep accurate medical records and keep up with the prescriptions that the patients have requested, and comply with the controlled substance laws and regulations. Some of the questions that we could ask the patients are, have you ever felt the need to cut down on the use of your prescription drugs? Have you ever felt embarrassed or annoyed by the remarks that your friends or loved ones have made about your prescription drug use? Have you ever felt guilty or remorseful about your use of prescription drugs? And have you ever used prescription drugs in a way to calm down or get going? In my experience working in the healthcare field, a few years ago when I worked on medical surgical units, we would see patients often that come in that had been abusing narcotics or prescription pain medications, and it was really hard to get their pain under control. It would require more pain medication, stronger, a larger dose to get their pain under control. Also, we would see some patients that would come in who had been abusing prescription medications, maybe like Klonopin or Xanax or something of that nature, and the doctor didn't know they were taking it, so he didn't prescribe it, and the family was unaware of the level of use that they had, and it resulted in some withdrawals like seizures, and it was really stressful and embarrassing for the patient, and it is also stressful for us, the nurses that had to take care of the patient. In my job now, I work with maternity patients. We have to handle the patients that abuse drugs a little bit differently in that if we embarrass them or if we make them feel too uncomfortable, they won't come to the maternity appointments. We come right out and say in class, I always tell them that we need to know everything that they're on, prescription, non-prescription. If they're taking a prescription drug that is not their prescription, if they go to a pain clinic, methadone, Suboxone, or Subutex, then we need to know it so that we can help them and take care of the baby and make sure they're both healthy. Our physicians do not prescribe any type of narcotic pain medicine. If they feel like that it is warranted, they refer them out to another provider to write those prescriptions. And that is the end of my discussion.